Next speaker is going to be a PhD student, Lauren Steinbaum. Lauren is going to talk about her work on detection of soil-transmitted helminth eggs on hands and produce in rural Kenyan households. Lauren.
Okay, I'm guessing this is it. All right, so today I'm going to talk about a pilot study that we did about the detection of soil-transmitted helminth eggs on mothers' hands and produce in rural Kenyan households. Why are we doing this? Well, about 1.5 billion people are infected with soil-transmitted helminths. That's almost a quarter of the world's population. And these infections can have long-term effects, particularly in children, including stunting and cognitive delays. Also, soil-transmitted helminths are the most prevalent cause of neglected tropical diseases. So the framework for our study is the F diagram for disease transmission, which is a way to explain potential fecal-oral transmission pathways of contamination. So as you see, feces can be transmitted through fluids, fingers, flies, fields and floors, and food to their next host. For our study, we focused specifically on fingers and food. And we did this because these are very understudied transmission pathways, especially for soil-transmitted helminths. And for hands and fingers, one of the main issues with trying to look for STH or soil-transmitted helminth eggs on fingers is that there's not really a great method out there, and not a lot of work has been done in this area. And for food, our unique contribution is that we're looking at food that's grown in household shambas or gardens instead of market produce, which is often studied, in surveys. The main research questions that we're looking at are first, how prevalent are STH eggs on caretakers' hands and household produce in our study area? And then also, is hand and produce contamination related to other contamination, for example, in soil? We worked in Kakamega, Kenya, which is in the western part of Kenya. And we focused on households that are enrolled in the active control of the WASH benefit study. So we chose households in the active control so that there were no potential intervention effects that would confound our results. And the WASH benefit study is a large randomized control trial that was looking to understand the impact of water, sanitation, hygiene, and nutrition interventions on child health. From our work with WASH benefits, we know that ascaris is the most common STH in this area, and it's most common in humans, in stool samples, and also in soil in households. And specifically in the households we sampled, we know that about a third of them had previously had soil contamination at the entrance to their homes. I think it's also interesting to note that these households were subject to both compound-level deworming and a national school-based deworming program. We went to 116 households and we collected 2 hand rinse samples per respondent, 1 for each hand, and up to 2 produce samples per household. And we prioritized collecting leafy and root produce because we thought that there could potentially be, different impacts on transmission or contamination. And we analyzed these samples using a hand rinse method, pretty much the only hand rinse method that is published by Gulliver in 2014. And we used this for both the hand and produce rinses. We did find STH eggs on hands. About 1% of hand rinses were positive. In reality, this means that 2 of our respondents out of the 116 had STH eggs on their hands. And this number might seem low, but 1 egg can cause infection. So I think it's important to think about it in that context. And to give you a sense of how this relates to other studies, the study that I referenced, where we're using an adaptation of their method, they found that 34% of their respondents had contaminated hands. However, the context of our study is very different than theirs. They were sampling in an area that had very high prevalence of STH infection, about 70%. They were purposely sampling farmers' hands, and many of these farmers reported to have used human waste as fertilizer. We also detected STH eggs on produce. 3.5% of our leafy vegetable samples were positive for at least one STH egg, and about 2%, or 1 out of all of the root vegetables we collected, were positive for at least one STH egg. We did collect a few other produce items, including tomatoes, guavas, and sugarcane, and none of these had any STH eggs. Another interesting finding of ours is that in the context of the compound level deworming and the national school-based deworming, households that had past soil contamination were still more likely to have contamination on hands or produce 10 months after we sampled the soil. So to wrap things up, I hope I've convinced you that there are multiple pathways of transmission of STH through the household environment, and these are important. In our work so far, we've looked at fingers, food, and fields and floors, but I think there's a lot more room to look at fluids and flies as potential drivers of infection. And it's also important to note that this is a pilot study, and so there are a lot of limitations for what we can say. There's not a lot of work that we can compare this to, so I don't think it's fair to say whether we found high or low contamination compared to other contexts. But definitely more work needs to be done to understand the relative contribution of all of these pathways on infection, because then I think you can understand the different contexts in which contamination occurs through these pathways, and also that these pathways lead to infection. And finally, I think the idea behind this conference today is pathways and, well, oh gosh. Can someone shout it out? Okay, research to impact. For some reason, I thought there was a pathways in there. But I think that the work that I'm presenting is kind of the beginning stages of understanding what is going on, what is happening in the environment. And I think there's a lot of potential impact. And potentially, that impact could be through interventions, specifically interventions seeking to reduce the prevalence of STH. And these programs should consider the role of the household environment in transmission. And I'd like to acknowledge our great lab and field staff, and also point out Claire Knoll, Holly Dents, and Ryan Mahoney, who were extremely important in setting up the infrastructure behind this project. And with that, I'd be happy to take any questions.
Hi, Lauren. Great talk. Just two quick questions. Were you able to do egg viability assays when you isolate the eggs from the different sources? And also, I know you're continuing this work, and it's very exciting. And just with your guess, how do you think some of these environmental sampling techniques will be able to allow us to infer incidence with compared to like common sampling strategies like prevalence surveys and such? Thanks.
I think that your first question is a great point. That, unfortunately, is a slight limitation in this study. We did not have time to do any sort of viability testing because it requires about an extra month. For the soil sampling I mentioned, we do have a lot of viability estimates, but we didn't include that for the hand and produce sampling. And then Your second question was incidence versus prevalence.
How to basically map some of these environmental predictors into some way to infer incidence or prevalence and how that kind of compares to our current method, which is just the stool samples to do the prevalence surveys. Because this could potentially be a more indicative measure because you're looking at real-time incidence rather than some historical record of prevalence.
Right. I think that when you look at eggs in the environment, it's somewhat unclear right now what picture you're giving, because on one hand, it could relate to, it could be a sort of a cause or effect of infection, and I think more work needs to be done to understand the association between these environmental pathways and infection, but also, beyond just association, I think having clear causal linkages would be very useful and important. I think some of that might come down to looking at behaviors and how people interact with their environment and how that causes infection. Because still looking at the environment, I think it can be useful to give a sense for what's happening in the community, the household, but it can't predict infection.
Lauren, just moderator's prerogative here. One more question. As you look at how soil-transmitted helminths are trying to be controlled in sub-Saharan Africa, this is primarily through a medical model, through mass drug administration. Can you just reflect a little bit on how you feel this look at the environment might help us inform how we think about and ultimately how we might approach the problem?
Yeah, so I think that often medical professionals and engineers have a very different point of view when it comes to controlling disease, and especially I think that's true for soil-transmitted helminths, where medical professionals and a lot of people in public health focus on mass drug administration, while engineers seem to focus a lot on WASH, water, sanitation, and hygiene. I think more work is being done to combine those two and see what happens when you have both mass drug administration and WASH, but they also have different impacts, where mass drug administration has a very immediate impact on people, where worm prevalence is just reduced or eliminated completely immediately, but then people get reinfected, and I think that's where WASH comes in, because it helps prevent long-term contamination of the environment, I'll say potentially. But I think that the key to eventually reducing or hopefully eliminating STH is understanding how and why people are getting infected and having more targeted approaches to hopefully prevent infection altogether.
Thank you very much, Lauren.
Thanks.